Welcome back to East Texas Now. Joined with us at the desk is Mr. Blake Holland. Blake, we've heard some sniffles. We've heard some coughs around the office. We've even had a couple people call out in the last week, but it's not just affecting us. It's kind of affecting all of East Texas.
Yeah, newsroom this time of year is like a microcosm as to what's going on in the area. We've learned this in past cold and flu seasons, and we know that illnesses are spreading here, so we know they are spreading in the community because that's where they begin, right?
Oh, yeah.
So we want to take a look at some information right now from the Department of State Health Services. This is data that was released last week. They'll release another report come tomorrow, but this is looking at flu activity, and also in a bit we'll take a look at just all respiratory viruses, because so many of these illnesses that are spreading, the symptoms are very similar, and without a test or maybe some very specific symptoms, it can be hard to know exactly what you have or your family or your friends have. So this year we're seeing a lot of flu this time of year. This information comes from the Department of State Health Services, but also we just spoke with the Smith County Health Authority, Dr. Valerie Smith. She told us seeing a lot of flu. She's a practicing physician as well. And then we also spoke with the pharmacist over at Drug Emporium in Tyler, and based off of the things he's being prescribed and the people that come into him seeking some help with over-the-counter meds, also seeing a lot of flu, more than we saw last year. You might remember we had that so-called triple-demic, flu, RSV, COVID. Saw a lot of RSV in pediatric patients, saw a lot of COVID, but not near as many flu cases as we have seen in previous years.
Right.
But this year it's a different story. So this shows you the number and the percentage of tests that are coming back positive for flu, and it breaks them down by the actual types here: flu B, flu A, and then more specific H3N2, and then H1N1, which we all know as swine flu from many years ago. So you can see that the trend continues to tick up there. A lot of flu B cases, a lot of cases of flu A. Those right now more than cases of flu B. And you can see for much of the cold and flu season, the start, October through November, while it did climb and the trend does go up, there was no real significant spike.
Right.
If you'll scroll down now, I believe this is going to be on page 5.
All right, go down here. So much fantastic information.
It is, and it can be kind of hard to understand, so hopefully we can break this stuff down for you. So we talked about flu cases specifically. So that last graphic shows you the tests that were coming back positive. This is a different kind of graphic. So this looks at the number of people visiting a clinic with a flu-like illness. That doesn't necessarily mean it's flu, but this is a great representation of all respiratory viruses, which is what we're seeing right now. It's a mix of flu, there's some COVID in there, and also RSV is still spreading. So this shows you the data from across the state, and if you look for that yellow line, that is this cold and flu season. If you look at the blue line, that was last year. So we were talking about that triple-demic that happened last year, and you can see that peaked a lot earlier than what we're seeing this year. So last year from October, we climbed into November where we peaked, and then we started to come down by the holidays in December through January. This year is a little different, you can see, and the line is not as defined as we've seen in previous seasons, especially when compared to last year. So the 2023-2024 season, you can see that in November we had a little bit of a hump. We came back down, and then now here in December we continue to climb back up, and we will, as you can see there, if the trend continues, we will go over where we were this time last year, but still below the peak from last year. So we talked with that doctor earlier, Dr. Smith, our Smith County Health Authority. We talked with Mr. Davis, the pharmacist at Drug Emporium, to kind of get an idea of what is spreading. And again, right now it's COVID, RSV, and a lot of flu cases right now. We know that even from working here, and some folks have come down with the flu here. So the next question is, if you happen to be one of these people with a sore throat, a cough, it can be hard to figure out exactly what you have without a test. But you don't necessarily have to go to the doctor with everything. So really there are kind of some thresholds and some standards that doctors recommend. That be the time you decide, okay, I need to go see a doctor about this. That is, if you have trouble breathing, you should see a doctor. If you have any conditions, chronic illnesses that already exist, so if you have asthma, if you have COPD, those are things that are going to require you to go ahead and see a doctor when you start to feel bad. as in terms of kind of on your own figuring out without a test what you have,
Right.
it can be very hard because so many of these symptoms are very similar. Flu, there are some different symptoms though, and also the severity of those symptoms is a little bit higher than the other illnesses. So doctors say when you have a case of the flu, you're probably going to have more severe body aches, you're going to generally feel unwell, and you also have more GI symptoms. So nausea, vomiting, possibly diarrhea, those often come with the flu.
Right.
When it comes to COVID symptoms this time around, Mr. Davis down at Drug Emporium told me that he is seeing cases of the COVID-19. Those symptoms seem to be less severe this year, which is some good news.
Yeah.
And so it can kind of be hard at times to tell the difference between if you have a cold, one of these respiratory bugs, and COVID. But if you happen to have a case of the flu, those symptoms are going to be a little more severe.
And that's great moving forward to know, because if you do have those more severe, from the last few years, had we not had this information, you would lean towards, oh, I think it might be COVID. But now knowing that the trend is COVID has less severe symptoms, flu has more of the more severe symptoms, that's easier to say, hey, I need to get tested for this, or maybe I can try some over-the-counter things if I don't have to go into a public space to be able to get seen by a doctor,
Exactly. You mentioned, kind of self-treating, and of course there are recommendations that doctors want you to follow. And again, if you happen to meet one of those qualifications to go to the doctor, you should. If you can't breathe, if you have a pre-existing condition, go see your doctor. But if you're a fairly healthy person who can fight this on your own with a little bit of time, a little TLC, you can get some over-the-counter medicines. You're going to want to treat your symptoms because that's really all you can do. So if you have a sore throat, get maybe a cough syrup, an antihistamine if you have a postnasal drip, and also some pain reliever if you happen to feel bad, you have those aches and pains or maybe a fever.
It's just a waiting game, and you might as well not be miserable while you're waiting it all out.
That is exactly what doctors say. And if you feel like you need to go to the doctor and get tested and you want to know what you have, especially if you've been around a lot of people, that is also recommended. It's a fairly simple process. There are tests for COVID, there are tests for RSV, and then there, of course, are flu tests.
Right.
When it comes to what they're prescribing for flu, of course, you'd have to go see a doctor, and if they feel you are fit for a prescription, there are antiviral medications.
Right.
So with the case with all of these illnesses, these are all viral illnesses we're talking about. COVID, RSV, flu. So getting an antibiotic, that's not going to work.
Right.
A bottle of pink amoxicillin is not going to treat a viral infection. But there are antivirals. So Tamiflu, that's the one that's been around for quite a while. And then there's another one also, and I forget the name. It almost sounds like the name of a Muppet. But we're going to have more on this in our story later tonight. But there's another antiviral medication that is actually a once-and-done pill that's fairly new in recent years.
Wow.
Whereas Tamiflu, you take that over the course of several days. There's a fairly new medication that you can just take one pill and it begins to work.
Well, I feel like that's a fantastic tease to see about our story later.
That's right.
You have to tune in to see what that medication is called. I just want to note before we go, Blake, there's a lot of people that, like you said, self-medicate, and that most of the times, if you're healthy and if you don't have any kind of pre-existing conditions, could work for you. However, you do want to take into account who you're going to be around that might have some pre-existing conditions as well. Just keep it in the back of your mind if you're going to be around, infants, children that maybe have not been able to get all of their vaccinations as of yet, or maybe family members that have other pre-existing conditions. You might want to go, you might think it's just a cold or something like that, but you always want to have that in the back of your mind if you have plans for the new year to be around family or be around other vulnerable loved ones, to go and get tested just for, if anything, for everybody's sake of their mental health, to be like, hey, I got tested. It is not, these things that could render your child or your family member susceptible to anything more serious, so I am okay. Or the other way around, you think it's not that serious, you get tested, oh man, I do have COVID, I should not attend that New Year's party,
And you mentioned that through the COVID times, we heard that many times. If you're sick, stay home.
Exactly.
And that continues to be the advice, because these types of illnesses, they're easy to catch, they're easy to spread. They're respiratory viruses, and so they spread in a couple of different ways. One is you and I are speaking here. If I happen to be sick, the droplets.
We're within those 6 feet.
That's right. The droplets that undoubtedly come out of my mouth and come out of yours when we're talking to each other, those kind of enter into our breathing area. You can get sick that way. And also with some of these illnesses, they're airborne. So they kind of sit in the air as a droplet if somebody's been sick in an area, and you can breathe that in. And so if you have a respiratory illness, the best way to prevent other people from getting it is to stay home for a little bit until your symptoms die down. And especially if you have a fever, you don't want to be going out among people. And so while it may be hard, New Year's gatherings are coming up. If you're one of those people, you know you're sick. Best to stay home so you don't let your friends and family enter the new year with something they didn't want from you.
And 2 years ago, that's how my entire family, including my 3-month-old son, got COVID. It's from a New Year's celebration that nobody knew. People were asymptomatic, and then we all got COVID. Now, we were, grateful and thankful enough to not have a severe case, but that's not always the case. So you want to make sure that you have that in the back of your mind as we're moving through the end of these holiday seasons. Blake, I look forward to hearing what the name of that medication is and more from both of these physicians later on tonight.
Yeah, Dr. Valerie Smith, our Smith County Health Authority, and then Mr. Davis, the pharmacist down at Drug Emporium, who's always kind enough to talk with us. So a lot more coming up tonight at 6.
All right. Thanks, Blake, for stopping by.
Sure. Thank you.